Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. I know you are all preparing for a Thanksgiving dinner with your family, but also you have not stopped working nonstop, whether it be Medicare, ACA, or group renewals for the first quarter. Never a dull moment, ever a dull moment. This morning I was reading to see if there was anything I might have missed recently about the ACA, extended tax credits, anything healthcare. And I'll be honest, it was like reading Peyton Place. Some of the things going on Capitol Hill are just purely insane. I'm not sure how they could agree on anything when there's so much happening. One person has done this, another person is telling on this person is getting in trouble, this person is resigning. It is truly like reading Peyton Place. I'm going to say my mind has been blown. What we do know is they're still talking about the extended tax credits and maybe putting some kind of Band-Aid and allowing them to extend for a certain amount of time until they can come up with some new ideas for handling healthcare in a different way, handling health insurance in a different way, trying to control costs. What that looks like, I'm not really sure. There's a lot of different stories and ideas out there, but know that we're seeing a lot. It's going to be pretty hard to make something happen for our January 1 renewals. It just is, because there's too much internal fighting. The Senate seems to be more on track than the House. The House is still refusing to come to any type of logical thoughts, or I'm just not really sure. I'll be honest. So it really does look like January 1, the rates are going to hold, ugly as they are. I've done some national media interviews about, what do we do? What does that look like? And of course, like I've said, in some states, short-term medical is an option. If you're healthy, there is health, questions, but not every state allows you to have that. People are selling other products. If you're eligible for your employer plan, I have folks that I've heard from that are getting on their employer plan. So, and then some mom and pop shops are starting, some husband and wife, if a state allows, if an insurance company allows them to have a plan, that's another option that's being talked about. But so much on our plate, so many different things happening. But again, I've always said, you will survive, you will figure it out. I'm not sure what it's going to look like, but when I figure out and when I know more, I will absolutely report it. Also, I'm trying very hard to get some meetings put together with CMS, the insurance companies, and commissioners of insurance. There are, I think, up to maybe 10 states now that have stood up and said, not in our state will you not pay Medicare commissions. I sincerely wish that some of the other associations and agents would ask, when you're asking the states to extend, like Oklahoma did, and say also ACA. I mean, regardless what you sell, if you sell ACA, Medicare, or group, we need to be all one team and all one family and all fighting for the same thing. ACA commissions are being attacked just as Medicare commissions are being attacked, and we all should be fighting together to make sure that doesn't happen. Now, what I've talked about in the past is that United Healthcare and Molina have decided that the Consolidated Appropriations Act of 2021 says that agents and brokers can be responsible for disclosing ACA commissions. I encourage you to Google it. You can see plain as day. It says that it is the insurance company's responsibility. Still fighting that. In the meantime, they have stated that they have added that to your contracts. You signed it, you have it. I'm not sure legally. I'm not an attorney. I'm not sure what that looks like, but I'm assuming since you signed it, you need to make sure you disclose it. How do you disclose it? I have no earthly idea, and I'm working on that. In the Consolidated Appropriations Act of 2021, it's very distinct in how you as an agent disclose group commissions. tells you what the thresholds hold, what it looks like. It's very easy to figure out. We had attorneys look at it years ago, 2021, and we figured it out for our agents working in that employer market. However, for those that are in the ACA market, we didn't come up with a form. We didn't come up with any guidelines because there were no guidelines, or HAFA would have been on it and had it done for you. But this is new. So we're working with our attorneys. We're working with Health Sherpa. We're trying to work with the United Healthcare attorneys. I did ask Melina's attorneys to show me where they interpreted in the law that it was our responsibility. I haven't heard back. I also am working with CMS. Come on, we need a sheriff. We need somebody to step up and say, insurance companies, you're not allowed to act as you're acting and treat agents and brokers like you're like you're treating us. Do know that United Healthcare is pulling contracts. They're going to say that they haven't, that they're not, but they are. I have one client that was pulled. Faith is eating my new box for my printer. They have taken the contract for an agent for United Healthcare without due course. As many of you know, last year CMS did that for many agents, and majority got your certifications back. But it was done without due process. It was done without anyone, being proven guilty. So CMS stopped doing that. They're like, okay, we're only going to process people like it should be, and we're going to go out after the bad, which we encourage you to go after the bad. But some insurance companies have stepped up and said, we're just going to take the I'm not sure what you call it when you're running the baton. We're going to take the baton from CMS, and we're just going to keep doing what they were doing, and we're going to take people's certifications and contracts without them being proven guilty. We're just going to do it, and they're doing it. That's the truth. You want to know the truth? That's the truth. Now, a lot of things are happening. Just know that I'm here. I'm fighting for you. And I hope you have a wonderful Thanksgiving. I hope you take a little bit of time off. I know most of y'all are going to be working through Thanksgiving. I know we all are. There's no way around it. But if you need me, I'm here. My staff will be here this week. So please let me know if I can help. And just know that I love you. And I'm fighting for you every day. Have a great day. Talk to you soon.